And welcome back to the morning show. We're down here with Dr. Brooks at his facility in the Riverview Mall, actually. Beautiful building, beautiful facility, nice, very nice, Doc.
Thanks. Nice to see you again. Welcome.
Thank you.
Welcome.
Thank you very much. You know, last time we were here, we talked a little bit about skin cancer. We talked a little bit about too much sun. We talked a lot of things, but we didn't really discuss too much about what to look out for. How do you tell that you're starting to get something bad on you?
Good question. And we have a lot of people come in with things that they don't think are anything that end up being very, very serious. And we have some people come in thinking things are nothing and they end up being very serious. So back and forth. I don't know if I said that right, but you know what I mean. Some things that don't look serious are very serious, and some things that look crazy aren't serious at all. I think that's what I was trying to say.
Okay.
So things to watch for, first of all, something that won't heal. If it bleeds, occasionally when you're drying off with a towel and the same spot keeps rubbing off and bleeds, that's a sign that you've probably got some skin cancer. Irregular borders usually is a sign that you've got some kinds of skin cancer. Color changes from pink to black, or from black to pink, or from brown to white, or white to tan. Any changes sometimes indicate that you've got some cancer brewing. And also size. If you can cover it completely with a pencil eraser, that's usually where we're a little bit less concerned. When you can't, that's instantly when we become more concerned. That's what we call the 6 millimeter rule. So the size matters too. The color changes, and also something that we don't talk about enough. We talk about the colors, like the A, B, C, D, and E's of skin cancer. But we don't talk enough about sensations. I've taken off multiple skin cancers, and the only sign that it was a cancer to the patient was a sensation change. So something that started to itch really bad, or something that burned really bad, or something that felt numb, or something that felt hot, or something that felt cold. Just a funny sensation change. Sometimes that can denote a cancer too. So
wow.
I guess the rule of thumb is, if there's a change that you don't recognize, then I would get in and get it seen by me or somebody. If it's something you've had since you were born that doesn't change at all, you're probably dealing with a pretty stable lesion. But any change really of any kind, I'd get it evaluated. That's what I would do.
Now, I know a lot of times, or not a lot of times, but I have been found to have little spots up in my scalp.
Yes.
And certainly over the top of the ears, another great spot to get nailed, because I don't wear a hat.
Yep.
I hate hats.
Yeah.
That's my visits to the doctor all the time. So people really do, I mean, you can feel the irregularity on your ear. I mean, if you rub the top of your ear and you find something that isn't there, why is that there? You flake it off. Might be a good time to check on it.
True. And like me, if you've got a little bald spot you didn't have when you were younger, the sun exposure hits that a lot harder, and the tops of your ears. One of the most common sites for cancer, believe it or not, I mean, it makes sense, is the driver's side. So all of us drive cars, so we have more exposure on that driver's side of the face. Yep.
Arm, huh?
Yep. This arm, the left face, the cheek, the ear, the top of the scalp, almost. I would say there's a solid, significant percentage of greater cancers on that driver's side. So if you notice something on that side and not on the other, that's also a sign to come in and get checked out.
Wow.
But the red, the scaly, the won't heal, the bloody, or the bleeds, or the irregularity, the color changes, the size, anything like that, you ought to get in and get evaluated. And it might be nothing. Also, it might be something, and I'm not trying to scare anybody, but I see enough and do enough surgery. We cut off, I don't know, we cut off multiple cancers a week.
Really?
Yeah, multiple a week. In fact, usually at least a couple every day. So it's that common. It's that common. Already had 2 today. So.
And it could have been prevented had they come in.
Correct.
With regular checkups and gotten it taken care of early on.
Exactly. You come in regularly, we find those little precancerous spots, they freeze off beautifully, away you go. If you keep waiting and waiting and waiting, then it can be a problem. And sometimes I've had people come in and I'll look and say, my goodness, how long has that been there? People say, oh, it's been there years. And I'm like, well, why didn't you come and get it checked? You know, and it ends up being a big deal. It ends up being a cosmetic issue where they lose a part of their nose or their ear, their cheek, or, you know, something that makes them not look as good as they want to look. So that's another incentive to get in sooner than later, so you don't have a cosmetic issue. Not that we can't solve it when it gets big, but we have to take more skin off, and it causes trouble.
So this I didn't understand. I didn't realize, but we see those people all the time with huge bandages, especially on surgery day.
Yep.
And they'll come out and they'll have this huge bandage on their face, and they wait there to see if it's cancerous, and they go back and forth. But by the end of the day, they've got a pretty good chunk of skin out of them. Um, that all started with a very small, insignificant, and could have been remedied a long time ago to where they didn't have to go through that.
Yeah, almost always, not always, but almost always. It starts off with a teeny little speck that someone will look in the mirror and say, oh, I don't think I've seen that before. What is that? And then they'll blow it off. And then a month later, I think, oh, I think that's getting a little bit bigger. And then they'll forget about it. And then 2 months later, I think, you know what? I really think that's... And so they'll well, I probably get it looked at. A year's gone by, and then you got a dime where you had a speck, and the dime ends up being a quarter, because a lot of these cancers, from what you can see on the surface, have a root system that go, well, roots is a loosely used term, right? But what you can see on the surface is actually the tip of a much broader cancer. So a lot of times what you can see, it really is the tip of a little iceberg. So as soon as you notice something, get in here so we can get it done.
Oh my gosh. For some reason, that's the first time that's hit me, because, and it would be so easy. I mean, I'm always checking it out because I've got to every morning. Okay, how do you look? And then you know what they do? They take that camera in the morning. I got this huge monitor in front of my desk, and they bring that thing all the way into here. And I'm trying to make them stop that, focus on something else, in the early focus. I just, look at her, she's smiling. She knows, she loves it. But, so in all honesty, if you don't want, half your face bandaged up or a big hole cut in your face, your forehead or your shoulder, your arm, whatever, you need to pay attention, because you're the one that knows there's something wrong.
Yep,
I mean, nobody else does. Maybe they do, and you just ain't listening too. Doc, I want to thank you very much.
Nice to see you.
Good seeing you, Dr.
Pleasure
Brooks.
again. Enjoy.
Stop by, ladies and gentlemen, or call, get an appointment. The phone number's on the screen, and get yourself over here and get just checked up, and then you don't have to worry about it this summer. What do you say?
Just takes a few minutes.
There you go.
Right.
We'll be back. More of the Morning Show right after this.